With that, I have the pleasure now of introducing Kitty McKay. She is definitely a force to be reckoned with indeed. Kitty McKay is a Carson, Tahoe Health Administrator of Community and Patient Experience and longtime resident of Douglas County. With that, for nearly 15 years, she has served her community within healthcare, dedicated to the fostering of human connections, hope, and healing. In her free time, she is also a co-owner with her music industry buddy of the Nashville Social Club, which I've had the pleasure of visiting. I suggest everybody do. They got some great food and great entertainment. Terrific venue. It's a hip southern restaurant, lounge, and music event hall in Carson City. Before setting up in northern Nevada 30 years ago, Kitty earned her professional chops living in Japan. Wow. While working in the global fashion industry as an American woman fluent in Japanese. After losing her second child, followed shortly thereafter by the sudden death of her first husband, she found the courage to rebuild an inspired life. She now shares her tools that she brought with her back to Wholesome as national acclaimed transformational storyteller, TED talker, speaker, and author of 2 books. Thank you, Kitty.
Thank you, dear. I really love that James called my husband my music industry buddy. So that's cool, because you want your husband to be your buddy, right? So I think we have some slides coming up here. Last year, we talked about our community health needs assessment. And we had several panelists up here, and we brought the news to everyone that every 3 years we assess the quad counties. It's something that the IRS requires us to do. It's the only good thing the IRS ever does. Oh, and yes, thank you. And what we found out, shockingly, but maybe not so shockingly now, is that mental health totally rose to the top. Mental health for adults, yes, but there's a crisis among our kids. So the Business Council asked us to come back and give an update. And that's what I'm here to do today. I want to warn you, what we're first going to talk about is going to feel really overwhelming and scary and really bad. But there's some very good news on the horizon. So if you buckle up and come along, it won't be too gruesome, okay? Everybody okay with that? So what the Community Health Needs Assessment told us is that the state of mental health in our quad counties, and yes, Douglas County, this is not just Las Vegas, we like to think that, but actually in Douglas County, and in our quad counties, we desperately needed more access to care, and we also really needed crisis care, and we needed community education. When we talk about community education, it's a whole lot about destigmatizing the conversation, because now it's all of us. So that's where our community health needs assessment has guided us. And our job at Carson Tahoe Health, we're mandated to now respond to the community health needs assessment. It told us that the situation of our kids is urgent and dire. And anyone that has kids, has grandkids, nieces and nephews, neighbors, we know that we're in this state now that is just crazy. How did we get to this crisis? What does urgent and dire mean? Well, sadly, it means that 1 in 5 of our kids are actively experiencing depression, anxiety, feelings of being isolated, planning their suicide. And in our quad counties, the use of cannabis and opioids and alcohol is higher than anywhere else. Let that sink in for a moment. These are our kids. You know, at the hospital, we have 8 pediatric beds. And on any given day, these beds that used to be filled with appendicitis, and tonsils, 8 of our beds are filled with kids in crisis, mental health crisis, kids as young as 6. Scary. But before you get too overwhelmed, there's something else. We're worst in the nation. The state of Nevada is the worst in the nation. It's unbelievable when I think about it. How could we be worst in the nation? We are such a cool group of people, right? We are number 50. We rank 50th for mental health in general and for our kids. And what that looks like, Maine is number 1. We're number 50, and it's for things like access to care, insurance that covers care, our kids feeling disconnected, difficulty making friends. So that's what worst in the nation looks like. And remember I told you there's some really good news. Do you know what best in the nation looks like? Are you ready? It looks like us. I want you to take one moment and really look around this room. Look around this room, please. Move your heads. Look at the people that are here today. Because while the state of Nevada may rank worst in the nation, our community ranks best. Because we care, we come together. We know we are bigger than this crisis. Because of every one of you in this room. I don't know about you, I just got chills because it's true. And so because we can come together and we know what we can achieve, we have dreamed a really bold vision. And it's called the Healing Our Kids Crusade. And this is not a Carson Tahoe health initiative. This is all of us coming together because our kids deserve it. And what it looks like is just like the Community Health Needs Assessment told us, we have to bolster our clinical services. We have to. And we have 2 amazing child psychiatrists. We have a legion of amazing therapists. So those clinical services, we need to increase. We know that. But what we also know is how do we get underneath what this damn problem is? We can't just have crisis care. How do we reboot things so kids aren't going into crisis? And what we realize, what it all boils down to, is establishing connection. Because we've lost that. As adults, we've certainly lost it, but boy, howdy, our kids are afloat, feeling alone. So we know we have to establish connection. That means connection to oneself. The beautiful environment James was talking about. How about one another? Trusting your voice. Connection to good food. All these old-fashioned things that just used to be there for kids, we have got to rebuild that. And that's what the Healing Our Kids Crusade is doing, is bringing those 2 things together. We think of it as a cultural transformation. It's a big word. Actually, those are 2 words. I'm not good at math. We think of it as a cultural transformation because we want our kids to feel alive again. I think about when I was a kid, I felt alive. I didn't watch the Disney movie on my phone alone in my room. I was out riding my bike, actually past the streetlights coming on and getting in trouble every single time. So alive is talking about being aware and embracing life. Feeling important, trusting your voice, uplifting your energy. That's what we want to give to our kids. We think of it as an integrated system of healing. So how that works is the destigmatizing and connecting and going to the people. Kids can't get to where we are. We have to go to where they are. And then also establishing those clinical services in a physical space. We call it a healing hub. So the really cool thing is Carson Tahoe, we just celebrated our 75th anniversary, and throughout that time, we've been very pioneering. Of late, you've probably or maybe heard about the Mallory Behavioral Health Crisis Center. We were one of the first in the nation, and we're still the only in the state of Nevada. And it's treating people how they need to be treated while in crisis. So because of our success with that and that kind of trailblazing confidence that we had when we established it, we are being looked at now as proven pioneers, which is really, really cool because we believe that we can create a new model for how our kids are growing up so they can reclaim their birthright. I mean, that sounds like almost melodramatic, but that's really the state we're in. And what we know is living in the community we live in, the commitment we have to one another, and our willingness to dream this big vision, that we can incubate a new way of doing things that we can then share with the rest of the nation. We're not staying last in the nation. We are going to become a lighthouse for the nation. That's pretty dang exciting. So what it looks like is great thanks to our governor, who really has focused so much of the energy on behavioral health and mental health, and great thanks to our state lawmakers who understand that we have got to turn this tide. So recently, we received 2 very significant grants that we're using to seed this Healing Our Kids crusade. So as of spring 2025, you will see that we will be opening for youth aged 12 to 17 a crisis center, inpatient care, and also greatly expanded outpatient care. We will have mobile RVs getting out into the community where the kids are to do what we consider whole health. It's a combination of clinical and this innovative programming, this alive programming. And then we also just received an over $1 million grant to partner with those in the community, like the Boys and Girls Club and the schools, to start providing this alive programming for our kids. And that focus, to begin, will be kids age 8 to 12. So we're still putting all the nuts and bolts together because we had to come up with this on the fly because the crisis was so big. And then we will be growing it into a healing hub on campus. And this is our vision in the next 5 to 6 years, that we will be able to create a whole facility that treats adults and kids and families and communities right there on the campus of Carson Tahoe Health. We don't have final estimates in, but it's well over $60 million, so we've got our work cut out for us. But you know, again, when I look out here and I look at this community and I know what our kids need, when we look at these kids' eyes, it's time and we can do it. So we're very excited to cast that vision. And you know, when you think about it, each of us is part of the solution, and our kids deserve this. It is our job to turn around and give this to them. So thank you for your time and your commitment, and let's go heal those kids. Go!